Did you know that in 2017, Nigeria recorded 67,000 maternal deaths? Hey there, beautiful people. I am Asmau Muhammad, the head of the Publicity Committee for Scora 2020, and today I have decided to displace the Scora Director to talk to you guys about maternal and perinatal health. Before I go on, did you know that in every minute a woman dies somewhere in the world due to complications of pregnancy and or childbirth? The UNICEF 2017 data recorded that Nigeria had a rate of 917 maternal deaths out of 100,000 live births. There is a record of 67,000 maternal deaths in Nigeria alone for the year 2017, and the crazy part is 80% of these deaths could have been prevented. Maternal perinatal health is simply the healthcare services given before, during and after delivery to ensure that the mother and the child are healthy. So now let's talk about the little things you can do as a woman who is trying to get pregnant or an expecting mother to ensure that you have a smooth and safe pregnancy throughout. I want to start with prenatal care, and for prenatal care I want you to think of PACT, the word PACT, P-A-C-T. P, plan ahead. A, avoid harmful substances. C, choose a healthy lifestyle. And T, talk to your primary healthcare provider. For planning ahead, you should try to get healthy, like try to live a healthy lifestyle even before you get pregnant. Try to avoid unhealthy practices such as smoking and drinking, and also before you get pregnant, once you know you have started trying to conceive, you should try to consume about 400 micrograms of folic acid daily. You can get folic acid in fruits and vegetables, beans, rice, and a few other food substances. But to be on the safer side, you could get a folic acid complement at your local drugstore. Choose a healthy lifestyle. Consume healthy diet. Try to get lots of protein, preferably lean protein. Consume lots of vegetables and fruits. Try to avoid too many fatty products, and also be physically active, and try to get underlying medical conditions in check such as hypertension or diabetes. And then for T, talk to your primary healthcare provider. Be sure that you are regular at your antenatal checkups, and make sure you confide your doctor in everything, no matter how irrelevant you might think it is. Be sure to mention it to your doctor whatever you might be experiencing. Summary: make a pact to stay healthy. As for the natal care, it's mostly the hospital's job, but things you can do to make it easier for yourself. As you get closer to your due date, you should pack an emergency bag that has all the essential things you might need in case of any surprises, and avoid being alone as you get closer to the due date, because anything could happen and you want to be safe throughout. And also try to welcome all the support you can get, because it gets tougher at that time. And finally, let's talk about postnatal care. The postnatal period ranges roughly around 6 to 8 weeks after delivery, and generally there should be provision of appropriate medical care for the mother and the child. You should ensure that you eat healthy, you eat the right way, maintain personal hygiene, try to engage in postnatal exercises. Immunization of the child should be done, and prevent harmful practices, especially harmful traditional practices that are quite common here in Nigeria. Before you do anything related to your child, make sure that it's safe. Consult your doctor. Never dismiss anything as just paranoia. It's better to be safe than sorry. Now, our colleagues from Ife Medical Association in OAU have a few words for you.
Everyone, I am Olofisha Charity Wasimulua, representing the Standing Committee on Sexual and Reproductive Health, including HIV/AIDS, SCORA, OAU, Ife. And today we're talking about perinatal and maternal health care. First off, perinatal and maternal health care is the health care of mothers and babies before, during, and after childbirth, which is the postpartum period. About 287,000 women in 2010 died of complications during pregnancy or childbirth. Now, many of these deaths could have been avoided as medical interventions exist and are well known. The problem is many of these pregnant women have lack of access to proper services before, during, and after childcare. But as of today, unfortunately, progress in reducing maternal mortality and providing family planning services has been too slow to meet the target.
period commences at 22 completed weeks of gestation and ends 7 days after birth. Perinatal and maternity health are closely linked. So, perinatal care. Perinatal care helps decrease the risks during pregnancy and increases safe and healthy deliveries. Regular prenatal visits can help your doctor monitor your pregnancy and identify problems or complications before they become serious. Babies born to mothers who lack perinatal care have triple the chance of being born at a very low birth rate. Newborns with low birth rate are 5 times more likely to die than those whose mothers received perinatal care. Perinatal care ideally starts at least 3 months before the mothers begin to conceive. Some healthy habits to follow during this period includes quitting of smoking, quitting of alcohol, taking folic acid supplements daily of about 400 to 800 micrograms, talking to your doctor about your medical condition, dietary supplements, and any over-the-counter or prescription drugs you take, avoiding all contact with toxic substances and chemicals at home or work that could be harmful to your body.
I'm here to talk about postpartum care. Now, while most care is focused on the 9 months of pregnancy, postpartum care is also very important. The postpartum period is at least 6 to 8 weeks after birth. It includes getting proper rest, nutrition, and vaginal care. Now, the body undergoes a lot of physical and emotional stress and changes during pregnancy. Postpartum care aims to address this. Now, getting proper rest. The mother has to have a lot of rest in order to have her body recover from the stress of pregnancy. Also, having nutrition, feeding well is also very important and essential in postpartum care. Also, vaginal care. Now, during pregnancy or after pregnancy, the mother undergoes various experiences, and such include vaginal soreness if there was a tear during delivery, and also complications with urination, such as pain and an increased urge to urinate. Also, there may be discharge of small blood clots, and there may be contractions a few days after.
Important for women to stay as healthy as possible during pregnancy and after pregnancy. And as such, women should stay on top of their healthcare appointments and listen to their doctor's instructions for the health and safety of themselves and their babies. Thank you very much. This is all we have for you for now. Stay tuned till next time. Bye.
Postpartum depression, anxiety, OCD, and other postpartum mood disorders are very real. And if you ever feel this way, know that you are not the first woman to experience this and you are not alone. Please reach out for help. Thank you for watching. Please be sure to like this video, subscribe, leave a comment, and share this with as many people as you can. We'd really appreciate it, and we look forward to seeing you again next time. Bye.